Hello and welcome to the Blue Tree Clinic's podcast series, bringing you all the latest mental health stories and news, coming to you live from London. And now, over to our host, Dr. Mark Silvert.
Hi everyone, I'm joined today on the 7th of August in the beginning of what has been a very rainy day with Nicola, our intern, and we are pleased to bring you a really interesting interview about clinical psychology and how you get there, which is a hot topic. And so I will pass you guys over to Nicola. Say hello.
Hi guys, how are you?
Thanks for joining us today, Nicola. Firstly, just tell us a bit about you, how old you are, where you're from, and what you've been doing, and how you came to find our clinic.
Yeah, so I'm 22 and I'm Irish. I'm now living in London to do with studies, but we'll get to that. I have done an undergraduate degree in psychology and English literature in Dublin. I found you guys, it's a bit of a funny story, that one. So I was at a yoga festival in Ireland and Rhiannon Lambert was giving a talk on nutrition, and at the time I was interested in becoming, well, at the time I thought I wanted to be a clinical psychologist, but there's just not a huge amount of information out there about how to go down that road. And Rhiannon mentioned that she worked with a team of psychiatrists and psychologists in conjunction with her nutrition. She's a nutritionist. And I just kind of, something clicked and I just thought maybe she had some advice or someone I could talk to. So I actually talked to her, went up to her at the end of her talk when most people were asking about like iron deficiencies, and just asked her if she had any career advice. And she said that, yeah, she had the perfect person to get in contact with, which is you, Mark. And she just said to send an email and explain where I was at. So that's what I did.
Great. Yeah, no, I remember that really well. I remember the email. It was a very nice email because sometimes, for any of you listening to this, we get a lot of emails. I'd say pretty much every day, not every day, but pretty much saying, can I do work experience? And one of the big errors that people make, because people do want to learn how to do work experience or how to be an intern at a psychiatry or psychology clinic or mental health clinic. And one of the big mistakes they make is just making it so generic. So they don't even put Dear Blue Tree Clinic or Dear Mark or Dear. It's just a copy and paste job. And I'll just delete those straight away because it just shows no interest. But I remember your email was, it seemed like you knew who we were, and it was very nice and professional. And I'll let you tell people what you did next because, for me, it was quite astounding that you came to see us. And I thought, to be fair, as busy as I wasn't really paying attention to, does this person sort of, I knew you were Irish, but I was like, is she living in East London somewhere? But I remember you sort of turned up and said, oh, I've flown in for an interview, which just was really impressive and obviously showed me the effort that you were willing to go to. But can you tell us a bit about that process and how we met and if you were nervous or what you remember from that?
Yeah, well, I thought it was a really good opportunity. When I reached out to you, you were really friendly and you said that, you're super busy in clinic and that really, if you were ever in London, that we could have a conversation in person. And in my head, that was kind of better for me anyway, because it's really hard to gauge these things via email and set things up when I needed to get a feel for everything as well and get a feel for London. At this point, I hadn't finished my undergrad. I was in my third year. I really did want the advice though, because you're really swamped, and I also wanted kind of refreshing advice outside of my university and my friend group and everything. But I thought about it, but then London and everything, and then I just mentioned it to my parents and they said, look, it's a really good opportunity, check and see when the cheap flights are. Dublin London is really close. I think I flew for £20 or £30 return. Wow. It was really cheap. It was just for the day. It literally popped over. It was like going from one end of Ireland to the other, so it wasn't a big deal in that sense. And yeah, it was great. You offered me loads of good advice that day. I probably still have it written down on some notepad or something that I had with me. Yeah, I thought about some questions before, and you actually, one thing that you told me about was to not kind of pigeonhole myself too much and look at the different therapies as well. Which I hadn't thought about before. You said you had a lot of therapists working for you. So that's something I really looked into as well, which was great advice because most people from university point of view, they actually don't tell you about those therapies. So for anyone who's listening that isn't aware, there's the road of becoming like a psychological well-being practitioner. So there's different kind of therapies. Do look to see if they're accredited, but you could do CBT therapy, psychotherapy. I mean, you have it all in the clinic. So yeah, I learned a lot that day.
Okay, good. And what I mainly remember is that you brought chocolate with you. That's my memory of that meeting. But no, you're obviously great and it went really well. And I think we just sort of immediately offered you the internship for 2019. So yeah, anyone that's listening, please don't apply this year. The internship is taken. And it was great meeting you. So what would be helpful for people is to understand what studying you've done up until now, which has led you on the path to becoming a clinical psychologist.
So originally, I suppose we'll go a few steps back. Originally, I thought about doing medicine. I really wanted to do it. And in Ireland, you have to do this thing called the HPAT, which gets you onto the thing. And that just didn't go to plan. And I actually went to an open day of a university and went to a talk on psychology. And I hadn't done like Leaving Cert, which is our kind of end of exams. I hadn't done psychology before, but the talk was absolutely amazing and it just really took my attention, and I was like, this is what I want to do now. So I applied, and luckily I got onto a course, so an undergraduate bachelor degree in psychology in Dublin. So that's 4 years, which is amazing, and I loved it. And throughout that I did some research work with one of my professors and was able to present at a conference. So I think those kind of things really help and stand to
Wow, what was your research in?
Yeah, so it was early life adversity and later psychological well-being. So there's like a big study that was done in Ireland over years, taking children and looking at them, how they fared throughout the years. And we took some of that data and looked at it, analysed it and presented it. So yeah, it was really interesting and amazing experience to do that as well. But yes, that was my undergrad studies.
Okay, great. So you get that degree and then you decide, what do you decide at that point?
Yeah, so in my final year, I, at this point, still thought that I wanted to do clinical psychology or at least work in therapy like you'd suggested. I kind of still back to the medicine thing. At this point, I'd definitely focused on the psychology, and I just wanted to work with patients, with people, really just always loved working with people and people's minds, hence I loved my psychology degree, wouldn't change any of it. So yeah, at that point I had to start applying to masters. Well, that's what I wanted to do. I mean, there's so many, I just want to say now that there's so many routes into psychology, and then there's so many types of psychology. I'm just focusing on like my personal journey so far and what I want to potentially do, which is clinical. So the advice I got was to look at masters because, I'm finished, qualified at 22 in my undergrad. You're really young to be a psychologist. You have a lot of experience to go and a lot of training still to go. And to get on to eventually to become a clinical psychology, you need a postgraduate doctorate. And really, this is where it starts to get more and more competitive. So having the masters gives you a lot of skills to get there, and also experience that they kind of look for in the interviews and things.
Right, yeah. So my understanding is, and I could be wrong, that becoming a clinical psychologist is actually harder than becoming a doctor. As you said, you were thinking about medicine, but from my understanding, it's more competitive, as you said, to become a clinical psychologist. So you're on the road now doing your master's, and you're also doing some work with us. And I believe you're also funding that by working as a waitress in London. We won't say where, because then loads of people turn up to see you. And you'll say, oh, we heard all about you on Blue Tree Clinic's podcast. But you're enjoying that job, but it sounds stressful doing three things. Like, how do you manage your own mental health, let's say, your own stress, doing three things at once? It's a lot.
It is a lot, and it's definitely something I want to touch on because, becoming a clinical psychology is really competitive, and it's difficult because you need experience. That's what everyone will tell you. You need experience. But getting experience, right, it's unpaid most of the time, or at least for a proportion of the time, because you haven't got the qualifications yet. So it's really difficult. So what I did is I applied for a master's, in London, especially because I had the internship, and the masters that I looked at that I kind of was drawn to were in London. And I was really lucky to get accepted to start my master's for next year at UCL. So that's in clinical mental health studies for anyone who wants to look at that. The course looks amazing, so I'm really excited to start. I can't comment on it yet because I haven't done it.
How many years is that?
So that's just 1 year. You can do it over the course of 2 years. So I chose to do it in 1 year.
Okay, and what kind of modules will you be doing?
Yeah, so the module list, they give you, we have to do a core module, which is in research. Then we have, the ones I'll probably choose would be anxiety and depression. There's a module on culture in clinic, which I think would be really interesting. I'm very much, my kind of area of interest throughout my undergraduate has been in child and adolescent mental health, as you know, Mark. So a lot of those modules I'll probably choose also. But yeah, there really is, you're spoilt for choice with the modules. It looks amazing. So I start that in September, but yeah, as I mentioned, I'm Irish. And I decided to move early. So I moved a few weeks after I finished my undergrad. I could have gone off traveling and all those things, which would be amazing. But I really just wanted to focus on, this is the most important thing to me at the moment. And I had the amazing internship offer from you, and I just thought the timing was right. I wanted to move before I know a lot more people coming in September, and I wanted to find my own feet first and gain some experience. And as you said, save a bit of money. So that's the tricky thing. It's definitely finding the balance of working, loans, there's all these things to juggle around. And so that's kind of tricky, but I work as a waitress. How do I manage my own mental health? I'm really lucky that I love the waitressing job that I have. I also am a big fan of yoga, if that's not too cliche. But I love anything, reading, anything that switches your mind off, anything that takes me away from my phone, as we were discussing earlier, is great for me. So yeah.
Yeah, that's really good, because I remember trying to tag you on Facebook and you're like, I don't have Facebook this week, I've switched it off. And I was like, oh, that's really amazing that you've actually done that. I think, kudos to you. Maybe we'll talk a little bit more about social media, because obviously you being 22, you have a different experience of it than I do. We might touch on that a bit later. I just want to focus on what we're talking about for the audience that's hopefully listening to this, about how to become a clinical psychologist. Once you finish this master's then, which does sound really interesting, what is the plan for you then? What are you going to do?
Yeah, so the next plan would be, an interesting advice I've gotten is to apply straight away for the doctorate. So to become the clinical psychologist, the next step is to do the doctorate. So it's a clinical doctorate, which is funded by the NHS. It's 3 years. You work with patients, and then you also have, you do kind of lectures, studies as well. So apparently it's very intense, but it is the chartered, so we were kind of discussing earlier. So really you want your qualification to be registered, like chartered, so with the British Psychological Society. So look at those different courses. Most of the ones you'll see pop up are. So it is funded by the NHS, which is amazing. So it's just getting that next step. So actually this year will be the most difficult, juggling all the things wise. I'm really lucky. The masters I have offers its students a placement 1 day a week with the NHS. So I'm starting that in a binge eating disorder unit in London, which will be amazing as well. And that is the kind of benefit, the luxury I have of doing the masters, is that they help you. Basically, they're kind of helping to craft this pathway for you, which is something that's given me great relief, that I don't have to, contacting places like the NHS on your own is scary. They did it for us, So all those perks, learning those modules is going to help. The next step for me after that would be, I may apply to the PhD straight away, but really not in the hope of actually getting onto one, more for the experience of the interviews, which is advice I got from one of my professors back home, which I think is a great idea. Interviews in any job are difficult, and the second time round you are going to be wiser. So to apply, and even if you don't get the interviews, just having an idea of what the application looks like, what you need, I think is a good place to start. even, you know, if you're 5 years behind me in the sense of steps wise or things, even just looking about what these kind of courses want is always a good place to start. So next year I hope to work as an assistant psychologist. So that would be in the NHS, similar to the placement I'm doing, just paid, and it's just a year, I'd say, maybe 2, we'll see. So that's the next step, and then on to the PhD. So it is a very, very long journey, as you can.
Wow, yeah. So even as a psychiatrist, I know the medical route into becoming a psychiatrist, but I knew vaguely some of these things, and I know it takes a long time. But so how old will you be when you can qualify as a psychologist and can start working in the NHS or in private practice as a psychologist?
So technically, if I got an assistant psychology job next year, I would be working for the NHS. But as you said, as a clinical psychologist, I have to do that PhD. So it would be, the PhD is 3 years. It depends how quickly you can do it. So if I did, so I'm 22 now, so we've got next year 23 plus 3, so 26-ish, 27.
That's still really young.
It is, when you think about it. I mean, when you're 18, you think, oh my goodness, if I'm not going to be qualified till then. But actually, the older you get, it just doesn't even matter. Plus, I don't really want to rush the process, because like I mentioned, I think my favourite area at the moment is child development, child and adolescent mental health. I love it. But I didn't want to pigeonhole myself too much and just focus on that, because there's other areas that I might not know about just yet and that might grasp my interest even more. So we'll see as time goes on.
Okay, so you've been with us for a month, sort of shadowing and doing some work experience in clinic as well. And obviously we won't talk about specific patients, so any patients listening to this, don't panic. But what kind of things have you seen that have interested you in terms of maybe, mental illness or recovery or medication? I know psychologists don't use medication, but is there anything that has stuck with you? Again, not talking about specific patients, but kind of things that you've seen that have been interesting.
Yeah, absolutely. Actually, one of the biggest things that I found interesting is to see the difference between a psychiatrist and a psychologist. And I know that a lot of people find that confusing. And even though I was studying psychology, I even found it a bit confusing until I saw it in reality, about how they're different, but how they completely support one another, and how both is so key to recovery. So for me, this is my interpretation, definitely correct me if I'm wrong. So a psychiatrist is a doctor, and they have the capacity to prescribe medication, and they've specified in mental health also. But the psychologists have more kind of maybe see their patients more regularly, more long term, and they are not prescribing the medication, but they're giving the patients the kind of toolkit to tackle life or their mental illness without the medication eventually. But initially I realized your medication is so important, and it can really help patients to maybe take that step and take the therapy.
Mm-hmm. Okay, so to anyone listening that wants to become a psychologist, so far, what have you learned? I mean, I've learned that hiring interns or having people come, is much harder than you'd think, because despite the volume of applications we get, we do try to help as much as we can. The interns we've had before, some have lasted just a week, and then you ask them to get involved or to do some work. Yeah, and this is paid work at times for projects, because we don't want to not pay people. We understand it's hard to be a student in London, but they just can't cope with some of the work we've had. So for everyone out there thinking, I'll do this, like it is, you've got to be motivated, which, I mean, you got on a flight and flew over to interview, and, anything we ask of you has, obviously we don't say you have to do it or needs to be done, but you do really need to be motivated, I think I'd say. So what tips would you give for people that want to apply to either be an intern in a clinic such as ours, or that wants to become a clinical psychologist? You must have like a few tips that would be helpful.
Definitely. You're absolutely right. You do need to be motivated. The biggest thing is, is this really what you want? I've just described, I better summarize kind of those steps, which as I said, there's probably people listening that have got into clinical psychology slightly different ways, but at the end of the day, the last step is to do that doctorate. So it is a long process. Is this really what you want? For me, it was a no-brainer after my undergraduate that I definitely wanted to work as a psychologist. I absolutely loved it. So, getting on that flight was so... I wanted to do it. I wanted to see this. I want to sit in a clinic. It's an incredible experience. So if you have that drive to it, that you really want to, then yes, absolutely, I can offer you some tips. But you really need to have that motivation yourself that this is really what you want to do.
So wait, what are those tips? Because I guess it sounds really hard. Like if you were trying to put someone off, what would you say? Because I always think when I interview, and maybe I did that with you, I'm like, this is how I'm going to try and put you off. So I try to put people off to see if they'll still want to do it, because those are really the candidates you want to work with. If you can say, this is going to be terrible, and the pay is really minimum, and the hours can be antisocial, and you're also going to have a job probably as you do as a waitress, and you're going to be studying. So do you really want to do this? Because I don't think it'll be much fun for you. If you still come back and say, yes, I really do, then I'm thinking, okay, this person's motivated, when I've made it out to be pretty miserable, even though I think it is actually, as you say, enjoyable. What would you tell people that are thinking about it, that they might want to reconsider if it's not for them? And what tips would you give if they've thought, no, it definitely still is? What do they need? What kind of character traits?
Yeah, so to put people off, definitely, as I said, the financial thing is difficult. At the moment, I work I actually have another job as another waitress as well. So I'm working a lot. So you work a lot of hours to kind of fund yourself and keep yourself afloat. So, and if you didn't want to do it, you're not going to put yourself through that, really, when you could have just come out of your psychology degree and applied for other jobs straight away, like teaching assistants and stuff, which is amazing, and that can lead you down so many routes as well. So there are options if this isn't what you want to. But and the other thing would be getting to where I am now. It's been tough academically. I guess you need I should have mentioned that earlier, you need a 2-1 to get a minimum of a 2-1 to even get onto majority of masters. It's kind of rare circumstances not. And then you need that 2-1 for your PhD. So already, and to get onto your psychology course in the first place was, I did mine in Ireland, and it was tough. It was competitive from that step. I think it's pretty competitive here too, from what I've heard. So so if you're not motivated for it, there are two things. Financially and academically, it's going to be tough up to this point. But what was the other question?
So the other question was, what do you feel would, be some helpful tips, or just some helpful tips really for people that are going down this, things that you've already learned that you might have done differently, or you could have done more efficiently? Is there anything? I know it's early days, it's only a bit, this is so early on in your career, but any tips of like where to live or how to find people to live with in London? Like, I'm more interested, I guess people might want, just as we finish this interview, things about living in London, let's say, or things that you found really helpful in getting a job quickly, anything.
Tips would be to, and you've probably heard this one before, but ask. It never hesitates. I literally asked someone that I didn't know at a yoga festival for career advice. So if you don't ask, she could have said, no, I'm really sorry, that's all, like, we don't have advice on that, and that would have been fine. But this has led me such a great opportunity. So definitely to ask as much, and even talking to you, and you mentioned the therapies. I didn't know about that. So I think, definitely to ask. Living in London, so I think I've been here 6 weeks or so, and I love it now. When I first arrived, it was a bit overwhelming because I definitely threw myself out there and was just like, I don't really know many people here, I don't have a job, like you said. But pretty quickly I applied for a lot of jobs. For me, always, like, the place I work in, it's easy enough to get a waitressing job in London at the moment, but it's really important to be happy in your job and to like the people as well, because you can work in any waitressing job. So I did apply, I did like 6 interviews or something, and then made a final decision. I had a date in mind, and I was like, I'm gonna settle on that date, and it was the best decision ever because I love where I work. Really nice people. So I think starting work is a good place to start meeting people as well, because I'm surrounded by people in similar age and stage in life to me. So that, and then joining the yoga studio has been amazing.
Oh yeah, do you want to give them a plug? Where do you go to do yoga?
So I do it in Try Yoga.
Where is that?
So there's actually like 5 or 6 different studios. The one I go to is in Soho, but I just go there because the other cafe job I do is like attached to that, and I get discounts on the yoga classes. Wow. So it's all these little things. Where there's a will, there's a way. If you have a hobby that you love that maybe you can't afford, you might do some volunteering work for them every week or something, and you'll get discounts.
So yeah, I guess my final question is, what have you enjoyed living in London? What kind of things have you seen or done in the last 6 weeks that you would recommend if we say put this podcast out and we describe it as, getting on a clinical psychology course and living in London, because I think both things are really interesting to people when you're going to be coming to London to do your courses here. And what things, like fun things, have you done?
So I'd say living in London, I've moved in summer, right? So it's really good weather. I actually knew I knew a few Irish people before I moved over. So I think just going to your park with friends, having a few drinks or something, has been really nice. I love thrift shopping, or like secondhand shopping is kind of a big hobby of mine, and Dublin is very limited. So I've had a great time with that.
I did not know you did that. Okay, great. We'll have to go through some of my junk in my study later and see if there's anything you want to buy. So that's really helpful, I think. Is there any final points you'd like to say, or to help somebody else that's really on the fence about it? I mean, I think you've given some great tips. Was there anything that I haven't asked you that you think would be useful for anyone that's listening to this that potentially wants to go into a psychological career? And it doesn't have to be clinical psychology. As I said to you, it could be CBT, it could be DBT, it could be lots of different therapies out there. And actually, the more I progress in my career, the more people in different walks of life that are in business, or they might have been chefs, they could be anything, that say they want to leave those roles and become some kind of psychological practitioner. So hopefully this will be helpful for people. I just wonder if there's one final sort of recommendation you would give people, because you are well and truly on your way, which is great.
Yeah, I actually would. I just thought there. I think looking at people's LinkedIns is really helpful. So yeah, when I started to I was looking for a while at child psychologists and child clinical psychologists, and to see how they got there. It's been so helpful, because like I said, there's not one pathway, and a lot of people go in much later than I have. I started at undergraduate and have worked up, but there's conversion courses, there's experience. But looking at people's LinkedIn is very interesting and really useful. Even if you're looking at like psychiatrists or therapists, it just gives you idea of, oh yeah, I could do that experience, like that's something I'd enjoy, or oh, they did that course, that looks interesting. So I'd say looking at people's LinkedIn, it might be a bit of a random one, but yeah.
No, that's a really good tip. So I guess, guys, like anyone that's listening to this, either on YouTube, or we're going to try and put this on iTunes with your help, Nicola, drop some comments down either on iTunes or on YouTube. And Nicola and I both monitor Instagram and all our social media. So, she'll respond to you if you do have any questions. And, thanks for coming in. We hope to have some interesting guests, and both you and I can have a little chat after this about who would be interesting for us to both interview together. And if you're coming into the clinic in the next few months, you might be lucky enough to meet Nicola. I'm sure she'd be delighted to meet some of you that might be listening to this. So yeah, thanks for coming in, and thanks for helping everyone that might be listening to how to become a psychologist. It was really helpful. So it's bye from me.
Bye, thank you.